federal government has no business legislating on health care. If states want to do that, that's fine. But it's not an issue for the federal government. Our Constitution doesn't allow for our federal government to be involved in this level of our lives. The role of our federal government is to protect the states so the states can do commerce, not to provide health care for everyone. If states want to have health care programs, that's fine. And in fact, if our government was working the way it's supposed to from the bottom up, states could afford to have health care programs. But as it is now, we're giving the bulk of our resources to the federal government, and then the federal government is handing them back down. They're taking $1 out of our wallet, giving us back 50 cents and telling us you're welcome. Mm-hmm. If our government were functioning in the order it's meant to, communities first, then states, then the federal government, so the states were handing the money up to the federal government for what the Constitution says they have the authority to do, the states could afford to have health care programs of some kind. But it's not a role for the federal government, period. What will come of it, what has to come of it, just like it does in our own houses when we have to decide what we're going to buy based on the money that we have. If our federal government is providing health care to every American, at some point they're going to have to decide what American gets treatment. And they're going to have to regulate how we behave to get that treatment.